If there's one thing I've noticed with patients over 50, it's this. They're at a crossroads. They're asking themselves, should I invest in restoring my smile? Should I just give up and start thinking about implants? Or maybe they're telling themselves, I should just let my teeth take their natural course and deal with it when it happens. I've seen all of these paths play out, and the results really do vary. Because your 50s can either be the decade you rebuild and protect your smile for 20, 30 more years, or one where you start losing it piece by piece. So today, we're breaking down the 8 mistakes that quietly age your smile, and more importantly, how to avoid every single one. But first, here's one thing I notice a lot of my older patients tend to overlook when it comes to their oral health. See, as we get older, our bodies naturally change, and that's just part of life. But what many people overlook is that there's a fine line between aging and neglect. And when it comes to your gums, that line matters a lot more than most people realize. So let's set the record straight. When it comes to gum recession, a common misconception is that it's something that just happens with age. But that's not really true. Yes, gums can thin a little over time, but things like aggressive brushing, clenching, skipping cleanings, or even smoking can make it happen way faster. Ignoring misaligned teeth makes it happen really fast too. And once that happens, you might start feeling sensitivity, notice your roots showing, or simply see that your smile looks a bit older. So here's a few small habits that can reverse that outcome. First, switch to a soft bristle toothbrush, or better yet, an electric one with a pressure sensor so you're not brushing too hard. I personally recommend the Oral-B IO electric toothbrush, in case you wondered. Second, avoid scrubbing your teeth like you're cleaning tiles. Instead, use gentle circular motions. And third, if you're already seeing early signs of gum recession, go to your dentist and ask them about grafting or aligning your teeth. That might be the solution for you. Now, there are many cases of older people actually needing veneers to completely restore the natural look of their teeth. But you can't just go to any practice and ask for that. That's because there's a chance they might set you up with something generic that looks out of place and doesn't fit your face. This is especially true for our patients who are in their 50s. Your teeth should not look like they belong to someone in their 20s. Number one, it looks weird. Number two, the dissonance isn't going to help you with your confidence. So, if you're looking to explore these options, you can book a consultation here with us in San Antonio. We'll walk you through the process of what your smile would look like at its best. Click the link in the description to book now. Now, this next one is crucial, yet people still don't take it seriously. I've seen it too many times. Patients come in because something hurts, breaks, or bleeds. And when we trace it back to the root cause, it almost always comes down to one thing: skipping regular checkups. Generally, everyone, regardless of age, should visit their dentist every 6 months. Problem is, they don't. Recent stats show that about half of Americans visit the dentist less than twice a year, and around only 40% go when something's wrong. But this habit, it's actually one of the fastest ways to turn small problems into big ones. So here's my advice. Don't wait until the last minute to book your next checkup. At this stage in your life, you've got time, you've got the resources, and you're still healthy enough to stay ahead of the game. So it's really the perfect time to make smart choices for your smile before any issues get a chance to start. Now, this next mistake is one I wish more people knew early on, way before their 50s. Because you might think you're improving your smile, but in reality, you could be worsening your teeth. I understand that everyone wants to have whiter teeth, but it's important to know that not all whitening methods are created equal. So you can't just grab a box of whitening strips from the store and expect zero side effects. In fact, some over-the-counter products can actually make your teeth more sensitive or all splotchy looking, simply because they strip away moisture from your teeth. So I suggest if you want to whiten your teeth, do it safely by talking to your dentist first. Thanks to advancements in dentistry, there's now several professional whitening treatments available that are designed to protect your teeth while giving you natural, safe results that last. Okay, here's something you probably haven't thought about in years, but trust me, it's worth checking on before it causes bigger problems. Some of my patients come in worried about tooth discoloration, only to find out that old bonding has leaked, which is hiding decay underneath. Because honestly, that crown or filling you got from the 90s, it's most likely not aging as gracefully as you are. So you might come in for a simple appearance issue, but you leave with one that's happening well beneath the surface. And the reason behind it is simple. Materials break down over time, shades shift, and old fillings don't always blend the way they used to. As a result, outdated dental work can affect the look and function of your teeth. That's why it's smart to replace old restorations every 10 to 15 years, or as soon as you notice shadowing or discoloration. When you do, go for modern materials that mimic the natural translucency of real teeth. I also recommend scheduling a restoration audit every few years with your dentist, just to make sure everything's holding up. And while you're at it, there's something else worth keeping an eye on. Because even if your dental work's holding up, your teeth might still be on the move. One way I like to put it is this. Think of your teeth like books on a shelf. Now imagine taking one out or tilting the shelf a little. You'll notice that if you do that, the rest start to lean over time. And the same thing kind of happens with your teeth. Just because you finished braces years ago doesn't mean your teeth stop moving. In fact, it can become even more noticeable in your 50s. As your bone density changes, your teeth may subtly shift, which can throw off alignment or make gaps appear. So, if you've noticed your smile looking slightly different lately, here's what you can do. Wear your retainers consistently, or consider clear aligners to gently realign your teeth. That way, your teeth won't shift around too much, and you'll have better control over them. But if you want a more thorough examination and concrete next steps, you can schedule an appointment with us. Again, the link's in the description. Now here's something I hear all the time from patients, and honestly, it's a red flag. See, there's plenty of things that are totally normal when it comes to your teeth. Like feeling a little zing when you sip something cold, that's absolutely fine. But dry mouth, especially if it happens often, that's a whole different story. And here's what most people don't realize. It's that constant dryness is one of the biggest hidden causes of cavities in adults over 50. Now don't get me wrong, if it happens every once in a while, it's nothing to be concerned about. But if it's becoming your new normal, that's when problems start stacking up. And sooner or later, you'll be dealing with faster tooth decay or bad breath. So before you get to that point, I want you to do this daily. Stay hydrated. Skip the mouthwash that contains alcohol and go for fluoride rinses or xylitol mints instead. Those help stimulate saliva and keep your mouth in a healthier balance. Now let me ask you something. When was the last time you actually looked at your smile up close? Because just like skin and hair, your smile changes over time. But a lot of people don't realize just how much. See, years of chewing, grinding, or even daily wear can subtly reshape your teeth. So the smile you had in your 30s might not look the same now. And that's totally normal. But at the same time, it doesn't mean you should just leave it as it is. Based on my experience, small aesthetic updates can completely refresh your smile and make it look more balanced and youthful, all without changing your natural look. And there's actually a few treatments that I recommend for this, including conservative bonding or veneers for worn edges, or something as simple as enamel recontouring and polishing to bring back your clean, natural smile. Because the point of these procedures isn't about chasing perfection. More importantly, it's about making you feel good about your appearance without losing what's uniquely you. And that brings us to the 8th mistake. So let me give you an example. Say 2 patients come in with cavities. On paper, both cases look exactly the same. But upon closer inspection, one needs a simple filling, while the other needs a bite adjustment and gum therapy. So what's the difference? The difference lies beneath the surface. Because as you get older, your teeth, your bite, and even your gum health evolve. And the causes behind these issues become more complex. That's why it's so important to find a dentist who truly understands midlife smiles. Someone who doesn't just look at your teeth, but also considers your habits, your goals, and what matters most to you at this stage of life. Because at 50, your biggest challenge isn't simply about brushing or flossing. It's making the right decision for your long-term health. So you can either restore your smile, completely remove your teeth and replace them with implants, or just wait and see what happens. Your dentist should help you make that choice with confidence, not pressure. And remember, maintaining your smile doesn't have to feel like a chore. If you want to see what an easy, dentist-approved cleaning routine looks like, I'll put that video on screen next.